Hi, I'm Jeffrey Paul, and this is the Hair Thinning and Loss Summit. And I'm going to be speaking to you, the professional salon individual that really has heard these words, I'm sure, multiple times. I think I'm losing my hair. What can you do for me? Or maybe, my hair seems to be falling out, or my scalp is so itchy, or I'm so oily on my scalp. What can you do to help me? And as a professional, you have to be frustrated with those words coming out of their mouths, because so often we don't have in the salon criteria of cures and products and everything else that we do a solution. And we haven't been linked together with professionals as medical practitioners to really be able to have them work with us as colleagues. But I have one that I'm going to introduce you to that will truly give us an education. Is Dr. Bauman from Boca Raton, Florida. Nationally and internationally known. He's one of 100 doctors around the country that is recognized as the best when it comes to hair management and hair restoration. He does trichology in his beautiful center, as well as laser services, PRP that you're going to learn about, and ultimately the surgery of the experts of artistic value transplants, from eyebrows, hairlines to full heads. So let me not waste your time. I want you to meet an incredible professional. This is Dr. Bauman from Boca Raton. Welcome, Dr. Bauman. Thank you for joining us.
Thanks, Jeffrey. It's really a pleasure to be on with you again.
Oh, good. I'm so glad you really educated the consumer for us in the Hair Summit as well. And I want to kind of now educate the salon people. And this came about because you and I happen to be talking about the relationship of when I've been down there to train with you, you had multiple salons and in the same room, multiple doctors and nurses and practitioners working together as you poured into us an education that was off the charts. But you didn't just educate us on trichology and help us learn a little bit more of the sciences behind the trichology that we do, but you educated us not only even on the part of the transplant, but you educated us on how to tie it together. How can you, as a practitioner, help the salon people? So give us some education now for the salon people that are watching this. Should they be afraid of you taking their clients away? Should they be afraid of losing their clients because of hair loss? What's the story?
Oh, God. Well, no, they shouldn't be afraid of us, taking away their clients. In fact, it's the opposite. The more hair they have growing, the more they're going to need you out there, to color it and to style it. And actually, it was one of the reasons why I started the hair coach program so many years ago, and that to combine the field of hair restoration with a cosmetologist, licensed cosmetologists, and other professionals who really at the front lines of seeing people with thinning hair and other scalp problems. So yeah, no, you shouldn't be afraid and fearful at all. In fact, we're going to make you look, we're going to make you like an amazing professional that you already are, but just even tenfold. You're going to look like a genius when you can refer to people that you need to refer to, or recommend treatments and services, and guide that client in a way that's going to really help them. You're going to provide so much value. It's going to be amazing.
That's neat. Well, let's educate them right now on the first level of treatment, which is, of course, I would consider trichology. First, explain to us what trichology is, because it's a bit of a new word, and I know it's not in the beauty book where we went to school.
Right.
So kind of educate us on trichology and what its purpose is and what it does for people.
Well, I'll tell you, trichology wasn't in medical school either, and it certainly wasn't in my fellowship in hair transplantation. And trichology is kind of an unknown science here in this part of the world, in the U.S., unfortunately. But in other places, like in Europe and in South America, trichologist, I should say, is the first person you go to if you have a hair problem, which is amazing. And a trichologist is someone who's like a liaison. Think of like an esthetician between the patient and the plastic surgeon or dermatologist. So a trichologist, in my practice, I have a full-time trichologist who's a licensed cosmetologist who can help me when I have patients that come to the clinic who have hair and scalp problems. Something maybe just hair thinning, it could be hair shedding, but it could also be symptoms of the scalp like itchy, flaky, or dry, dandruff. It could be oily scalp, dry hair, brittle hair, frizzy hair. Anything that has to do with something beyond maybe just simple hair growth, which I'm in charge of, I would get my trichologist involved. So trichology is the study of the hair and scalp. And although we don't have, what I brought Trichology really to, I think, a different level using the hair coach program, and that's our teaching and training program, information and protocols and knowledge that a hair professional can take back with them to help their clientele.
That is amazing. Let's go a little bit further now, because again, you've already enticed the thought process. Of course, a salon person can be trained to become a trichologist and become a complete department in a salon. But let's go a little bit further. You've also taken it to the next level. You've also brought tools to the industry to be able not only to support what you're doing, even on transplants, if they referred people to you, but also a relationship of managing that hair, program, even if it were out of state. Give them the understanding of where your hair coaching program really represents the tie between medical, salon, and the consumer.
Right. So the way I think about it is that the consumer is the stylist client and may sit in that stylist chair and have some hair symptom or hair problem, whether it's a thinning or other scalp problem. And they may say those words that you mentioned at the beginning of the talk today, that, they may ask their stylist, hey, what can you do about this problem? An oily scalp or some shedding hair or something. What Trichology brings to the table is science. And that's, I think, what's maybe been lacking, unfortunately, in the hair loss industry for a number of years now.
Mm-hmm.
But what we brought over is a scientific way to evaluate the scalp. And so a lot of these devices are from Italy. I traveled to Bologna, Italy myself to visit the location where they've developed a lot of these instruments and the evaluations and protocols of treatment. And what we do now is we can evaluate the scalp pH. We can look at the sebum production. We can look at the moisture level. We can look with micro cameras to see if there's oxidized sebum or not, if there's microorganism colonies or not. Try to assess the level of inflammation, as well as measure how much hair growth is happening in different areas of the scalp. So we develop a full baseline, and from those evaluations and from those measurements, then we can develop a plan of action. So the plan might be something as simple as, here, use this product a little bit more often at home. Or we may need to do some treatments here inside the office, inside the salon, or what I call Salon B inside my practice, where we do different types of treatments to the scalp. Everything from ozone steaming to massage to applying vials of medications and other treatments to the skin. And then, of course, sending them home with a regimen that's going to make sense, that's specifically customized to the client's problem.
You've done something that's really important, I think, for the audience that we're focused on right now, is that you've taken and taught what we've always believed, and I've written in my books, that if you're just using one of the protocols, or you're just using one of the modalities, let's say laser, a laser comb, a laser cap, a laser under the cap, all those things that are out there that have a working value, but by themselves have a very minute value, or they're using a topical, or they're using a nutritional. They go through all this process and never link it together in a protocol or a management program that they can help their clients continue to, comply to that process.
Right. And so you bring up a good point. Look, we have effective medical treatments now. I mean, there are lasers that are FDA approved for hair growth. We've got custom compounded topical medications that are powerful and not greasy or gooey. In-office treatments like PRP and such, even good nutritionals to help boost hair quality and quantity and such. But the compliance mechanism is the critical step. And so what we bring to the table now is that hair check measurement, a cross-sectional bundle measurement, which allows us to measure and monitor, for example, the amount of hair growth in different areas of the scalp. And so on a regular basis, 90-day intervals, patient's going to come in, get a measurement, and we're going to be able to tell that client, hey, you've got more hair here, the same hair here, or less hair here, and by exactly how much. So we'll know over the past 90 days how well, whatever protocol is they're using, how well that's worked. And that's
it's interesting.
A critical step.
It is so critical. That was the one additive to our trichology department that you'd really had an impact on my organization and my team. Because when I was able to bring back an instrument that could prove on site, specifically each and every time, that it either had growth or did not have growth in a 90-day increment, where I know that that's what happens, whether you're working out, whether you're doing diet, you give up just short of the success because there's no signs. You don't see the results at that point. So the rewards aren't there. But let's talk to the audience as if they may not understand a couple of these things because, again, it's new news.
Sure.
You mentioned something in one of your other interviews with me that probably I knew subconsciously, but blew me away when you said it was number one. These are people that you're talking to right now that sell shampoos, professional shampoos that really have real product in them.
Yeah.
And they have a struggle really getting people to sometimes agree and buy the right products. What's the greatest and biggest product in the world in sales for shampoo?
Yeah. The number one most popular shampoo in the world is Head and Shoulders. I mean, it's crazy. But what does that tell you about the condition of people's scalps?
Mm-hmm.
It's telling you that there's itchy, inflamed scalps out there, and a lot of them. And so there's something going on. We need to be able to address that. And so whether it's a moisture imbalance or sebum imbalance, we need to fix it. Is it overproduction, underproduction of those things? What's the pH and what's the right shampoo for them? The Head and Shoulders is just a Band-Aid. We know that.
Mm-hmm.
On the injury, for example, to cool it down. But how can we scientifically evaluate what's going on with that client's hair and scalp? You need the right tools to be able to do that. And you need the right training. You need the education. So I'm sure it's the same whether you're applying color or a straightening treatment or something. You need to know the protocol. You need to know what's the right thing to do for that clientele, no matter what their problem is. And that's the kind of thing that we can teach and train. And I think the trichologist is that liaison. That's that person who is the specialist, who has the tools and who has the knowledge, and then can follow the client over time to make sure that things are working. Mm-hmm. Look, I wish I could say that everything worked every single time 100%. That's not the way the world works. Mm-mm. Sometimes the product doesn't work the way you expect it. Sometimes the chemistry of the patient or client is different. And sometimes the client just can't be, doing the things that you want them to do. But if you can measure and monitor, then you'll know how to shift and adjust appropriately to get the right result.
And with the new instruments now that have been available with the help of the CR labs, early detection, you and I know in any medicine, in any health arena, early detection is the very onset of success. Sure. The later we're into the game, the more difficult, the more challenging, and then we'll advance maybe to the levels that you'll talk to us about and educate us on transplant. Mm-hmm. But the stylist is there. They're right in front of that mirror with that client every month. And they can start, once they're educated, to detect that issue and begin to become part of that solution for them. Would you agree?
Absolutely. I mean, we know that you have to, for example, lose 50% of the hair mass in a particular location of the scalp in order for it to look thin to the naked eye. I mean, wow, that's a lot. Imagine if you had to lose half your teeth before you realized you had a cavity. I mean, it'd be like ridiculous, right?
Right, right.
So you'd want to get on top of that hair thinning problem as soon as possible. And like I said, a stylist who recognizes the hair thinning before the client does, or they're going to look like the hero if we can protect that hair and we can improve it. Because there's half of all people by the time they get to age 50 are going to have some hair thinning problems, and we need to nip it way before they get to that point.
That's a big number. What's happened over the last 25 years, I'm going to say, in the medical salon relationship. A lot of the cavaliers came in as surgeons, plastic surgeons, or not even plastic surgeons, just transplant surgeons, who could have been anybody, because I was at the conferences. They were teaching dentists and podiatrists how to do transplants into the melons, if you remember way back then. Mm-hmm. And the reality is that they would ask the salons to refer, and then they would discount them from being a participant of that client, their client, that became the patient and the co-patient of that couple, the salon and the medical practice. You've created a lot of systems, and you've helped a lot of doctors create the relationship with the referral basis of helping refer, whether it's they don't have trichology or they're not trichologists, to refer to you or to others that you refer in the country, but also to refer them back to be able to manage that program.
Correct.
You treated the salon, and the medical practitioners like you are starting to treat the salon professional that wants to live as a professional, act like a professional, and learn like a professional, the ability to feel that we're in this together.
Yes. Well, if we both have the same goals in mind, which is to help our clients or patients who are the same person, look and feel great, which is what an amazing head of hair does, there needs to be a symbiotic relationship there. And so it starts with some mutual respect, in my opinion. And that's why, I have a full-time cosmetologists in the practice. I mean, we work symbiotically together to help our clients do great. But for those professionals who are out there looking to elevate themselves, the trichology is an amazing way to do it. Imagine if you were the only trichologist in a very, very busy salon or barbershop. I mean, you'd probably have your hands full. And there's a lot of treatments and services that you can recommend that are non-medical, that can be done perhaps even inside the salon, that can generate revenue and increase your business, increase your foot traffic, and things like that. And so, we like helping stylists and salon owners and medi-spa owners become very successful in doing that. By providing a value to your client, just like we do to our patients, the reward comes, right after.
It is. It really is.
It's really simple. It's a simple equation. If you're providing something of value, then you're going to get rewarded for it.
Let's take the education and move it now forward. We've talked about going through the process of trichology. There are two things that are in the news that continue to pop up, and they use it, and people don't really understand what it is. One of them is PRP, which I want you to explain to the listening audience. And then the other one is Rogaine. Tell us about PRP, and then tell us about the new Rogaine, or the Rogaine that you can help us understand better.
Right. That's a pretty big dichotomy right there. I mean, Rogaine, was voted the least desirable hair growth treatment, least effective hair growth treatment in the world. We'll talk about that in a minute. Okay. But of course, PRP is exploding all over the news. Physicians are learning how to do PRP at a rapid pace. And what we're seeing is that a lot of patients and hair loss sufferers are running to clinicians who can provide PRP. So why are they doing that? What is PRP? So PRP is platelet-rich plasma. And PRP is something that's been used in many, many different areas of medicine. It's been used in orthopedics for professional athletes and those who are, Joe Golfer, who have been injured and want to rejuvenate their joints or tears in their muscles or tendons without surgery. It's been used by oral maxillofacial surgeons to increase bone production, to regenerate the bone, regenerate the gum tissue for dental implants and other reconstructive procedures. It's been used in dermatology to resurface and renew facial features and reduce the signs of aging. So what we're getting at here is that there's some kind of function of platelets that's different than what we were taught in grade school. They do a little bit more than just clot the blood, And so, for example, if you have a cut on your finger, yeah, of course, the bleeding stops due to the platelets, but there's also tissue regeneration and repair that's orchestrated by these cell fragments, which are what platelets are. So PRP is a treatment that we do in the office. It requires a small blood sample, about a test tube size, that we spin and concentrate and get just platelet-rich plasma. So that's a platelet concentrate. And there's things that we can do to that platelet-rich plasma to make it more effective in hair growth. But essentially what you need to know is that the platelets contain growth factors, which are proteins. Those are molecules that orchestrate tissue regeneration and repair and improve hair growth. The problem is that when it comes to PRP, it's like everybody's baking cookies, but using a different recipe. Mm-hmm. And as you and I know, my chocolate chip cookies might taste a little bit better than the guy down the block. So what we've developed over the past 6 or 7 years is a PRP production process. And this has been through trial and error, really. And through just, where the rubber meets the road in the clinic, developing new procedures and new methodologies to make our PRP that much more effective. And it's one of the reasons why patients keep coming back for our PRP treatments to improve their hair growth and why they're sought after from patients around the world.
And when I was in the OR with you, it was amazing to watch that take place. What you just described, even though it doesn't look very complicated, the science behind it is amazing. Taking a small amount of blood from the individual patient's arm, within a few minutes, you spin it at 1,000,000 miles an hour. I'm not quite sure how fast, but it's fast.
1,800 G, but yeah. Okay.
Yeah, I mean, it was moving, and suddenly the split happened. Then you added the stem cells, injected it back into the scalp, and it was, it was painless. It was very effective from what the patient that I talked to had results with. And then you actually do it both for the relationship of helping your surgery generate even a better result.
Exactly. And actually, that's how we got started with PRP. And I don't know if you remember, but I'm trained as a general surgeon first. And so I'm very, very cognizant of the things that we use to improve wound healing. And PRP is a really amazing wound healing agent for people with diabetic ulcers and things like that, non-healing wounds. And so we figured that if we use PRP as a topical agent on the skin, that we could get the skin to heal faster and better after hair transplant surgery. What we noticed is that even when we started to inject it into the scalp, that the transplanted hair started to grow better, thicker, stronger, sooner from the transplant, which was really, really nice. So this combination of hair transplantation plus PRP taught us that PRP alone was helping the non-transplanted hair. And so that's kind of how things got started. And of course, collaboration with other colleagues who were moving and pioneering this kind of technique forward was very, very helpful in the early stages. So now we don't have to do repeat PRPs every other month. We can do a specialized PRP that's going to last about a year, maybe even up to 2 years in some patients. And so there's some very specific ways that we're doing that. The PRP doesn't heal the patient. And I think this is important. What we're doing is the cells of the body, the stem cells that the patient has on their own, heal the body and to rejuvenate the follicles. But we're calling them to action with the PRP. And that's an important concept.
Right. Well, it's interesting you say that, because when I would be in surgery with many of the other doctors that I've worked with and helping design and consult the hairlines for their patients because they were still into the straight line concept, we would always be concerned about the hairs next to the transplanted hair. Even when the very finer transplants were being done, those hairs were already under trauma because of not only surgery, but because they were under male pattern or female pattern hair loss.
Sure.
This saves, because it's not a good deal if you put one in and lose one or two. That's not a good deal. That's a bad exchange.
Yeah.
What you're doing with the PRP, you're also giving the kind of the assuredness that the hairs that are next to the transplant, besides the transplanted hair, are better nutritionally strengthened and able to grow.
No, and it's very true. And and it's not just the PRP, but there's many things that we do to make sure that the non-transplanted hair sticks around over time. I mean, we want your transplant plus the hair that you have, to make it the final result. Otherwise, the non-transplanted hair becomes part of the problem instead of part of the solution. So that's where the medical management really comes in. And that's one of the things, many of our hair coaches will be doing after hair transplant surgery, is they'll be helping our patients measure and monitor not only the growth from the transplant, but also how are the other non-transplanted zones doing? That's right. And are those clients and patients on track to keep their existing hair growing strong?
Oh, that's right.
So maybe they'll need less transplants in the long run, but they'll be better off for it. And that's cool.
That's really so important. So important. Now, take them one last step into the understanding of the big world of hair replacement, hair management. The surgery is done. Do you throw minoxidil on, the most unwanted product in the world for hair replacement or hair management?
Yeah, so I can't remember how many years ago Consumer Reports rated Rogaine as the most disappointing hair growth treatment ever. And the reason people have such a disappointment with Rogaine, the active ingredient is minoxidil, is that most people either quit too soon, meaning they're not compliant with it long enough to see the results in the mirror, because that usually takes 6 to 12 months, or the product itself, the vehicle, is so greasy and gooey or messy to use that it interrupts their hairstyle and it's completely unacceptable, and they can't fit it into their regimen. So, and we knew this from many years back. I mean, minoxidil has been available for 30 years. And in the early days of my practice, we searched and searched for compounding pharmacists, clever chemists, to help us make a minoxidil better. And that's what compounding pharmacists typically do. They make a pill that's easier to swallow, or they make a medication into a lollipop for a kid who needs his life-saving medication and can't swallow. But the point is that we work with a compounding pharmacist that makes a really, really clever mixture of minoxidil. It's called Formula 82M. And what I found in my practice in Formula 82M is something that is easy for the patients to use. It's not greasy or gooey. It has a very good, strong amount of minoxidil in the ingredients, but it also has other features, like it has a penetrating agent and an anti-inflammatory and an anti-androgen and even a hair conditioner along with some antioxidants. So this really, really clever mixture called Formula 82M enables the patient to get the awesome results from using minoxidil without the common side effects and without being without the things that would interrupt their compliance normally with the over-the-counter Rogaine or generic versions.
Right. That's a wealth of education you've helped this audience hear. Let me ask you the last question, and I promise I'll let you go. I just keep you all night long just going on with our interview, because there's so much that I want the industry, the beauty industry, to know. I think this is really a key point in time. The esthetician world helped us in the med spas and the spas create an entity of revenue sourcing that was really incredible for a while. and that has been kind of diluted. The retail market was really great for us because we had the specialized products and brand products, but that has been diluted as well. But would you think, in your expertise and what you've seen all over the world of lecturing and everything else, that this is really an avenue for the salon to truly raise in their career levels of prestige and esteem in what they do for people, and join together with the future of what the market bears?
Well, absolutely. I mean, I think that we're right now in this confluence of time where we have the education and the science that can enable the stylists who are out there and and those who want to be affiliated with professionals in the medical field and elevate the med spas and so forth to come together to help these hair loss patients and other clients who have some hair and scalp issues. I mean, right now we're on the cusp of an explosion, I think. And if there's anything that's related to the demand for the hair coach program that we have and our other business arrangements in terms of the consulting that we're doing within the industry, I mean, this is an exciting time, I think, for the collaboration between the stylists who are on the front lines. I mean, and we work with so many great professionals who are out there and know their stuff, like the back of their hand, and the physicians who can really help some of those stylist clients with the thinning hair and other issues. I mean, it's really exciting stuff to see Trichology and Hair Coach kind of solidifying after so many years of having it in the back of my mind, to see it all kind of come together. I think it's going to take the industry by storm. Med spas, salons, and hair restoration physicians.
That's great. Well, Dr. Bauman, I want to thank you, and I want to thank you from the audience that is watching you, because you've helped them see behind the screen, so to say. And I just, that's something we don't often have, that opportunity, especially before the wave breaks. So if you're listening and you've watched this video, and you'll see many more in the hair loss and hair thinning summit, the relationship of what we've shared is really an opportunity for the salon market. I'm going to connect you with all the information of Dr. Bauman and all the education programs of the Hair Check program that he has. You can watch him on YouTube. You can learn more about him, maybe even visit his center down in Boca Raton. But again, if you're looking to help those clients that are saying those questions I opened the program with, I'm losing my hair, what can you do? My scalp is itching or oily, what can you do to help me? And you don't have answers. Now, at least you have the knowledge of where to go to get that information, along with so much more that we're going to share with you in this summit that has multiple experts from all over the world and real consumers that you're going to hear behind the scenes how they really feel about hair loss and the circumstances that they're going through to try to find the solution. So again, we thank Dr. Bauman and his entire team. We thank you guys, and remember that beauty and change begins within. I'm Jeffrey Paul. Thank you for joining us.